Okay, so hello everybody, my name is Jessica Reams, and today my presentation is going to be on equine diseases. So we're going to cover a couple of diseases that are very common in the equine industry. So the objectives for today's presentation as a whole is the students will learn about the different types of equine diseases and how they're required to deal with them with each specific disease, what prevents the disease, and how we treat the disease to best help the animal. So I'm going to start off with one that is very popular. It's called strangles. So I'm going to go through each disease and tell you guys what it is, what the symptoms of the disease is, what we do to prevent the disease, and the treatment of the disease. At any point, if you guys have any questions, feel free to stop me, ask, we'll go back over a slide, whatever it is, just know that you can stop me at any time and we can go through this. I know it's a lot of information, so we're going to try to go through this as easily as possible. So we'll start off with what is strangles. Strangles are one of the most common types of infectious disease in the equine species. It is very, very popular among the equine industry. Strangles is a bacterial infection of the lymph nodes in a horse's throat. So some symptoms of strangles are the horse will have a discharge of yellowy green mucus snot looking stuff coming out its nose. You can see that up in the picture up there on the right of what that discharge is going to look like. Your horse is going to have a fever. It's not going to be a super high fever, but the horse will have a noticeable fever. Your horse is going to be depressed. It's going to be either in the stall, looking at the corner. It's going to be off by itself if it lives in a herd. It's just overall, its happiness is not going to be there. Your horse may be coughing, and your horse is going to have a decrease of appetite, so they're not going to want to eat their grain. Hay is not going to be as appetizing to them. They're just not going to want to eat because they can't really swallow because their lymph nodes are so swollen that it's preventing them to do that. So what is a prevention of strangles? So the best way to prevent the sickness is through testing from the vet and isolation of the affected equine. So you want to take that horse and take it away from all of the other horses that are around it. It is a very contagious disease, and so you don't want to spread it. And so you just take that horse, you isolate it, you clean everything that horse has touched. You do not go see that horse and then go see another horse. You change your clothes, you wash your hands. It's very, very, very contagious. We treat strangles with getting all of the pus out of the horse's lymph glands and then treating them with topical antibiotics. Some vets will also prescribe the horse with anti-inflammatory medication. That's just to reduce the fever and make them feel a little bit better. All right, so the next disease that I'm going to talk about is equine herpes virus. So equine herpes virus is a respiratory ailment. So what does that mean? So the symptoms of what a respiratory ailment would be your horse would be coughing, your horse would have weight loss quickly. One day you'll come out and then maybe a week later your horse will be 100 pounds lighter. You can see his ribs. It'll happen pretty quickly. They also have a lot of eye infections if they continuously get like ketosis in their eyes. That can be a sign of herpesvirus, and then they'll have a little bit of nasal discharge, like the strangles does, but strangles has a lot more discharge. This will just be like a little runny nose, no color to it, just a little bit of mucus coming out. So what are the preventions for this? There's not really an injection that we can give the horse to prevent the disease. But we can help prevent the spread of the disease. So once the horse has it, we there's nothing we can do besides let it run its course and have that in prevention wise. But we can isolate the horse again, clean all the things that it touched, and do the quarantine type things. The treatment for it is medication to help the fever, so an anti-inflammatory. If the horse gets too lethargic, it won't want to get up, it won't want to stand, it won't want to eat, it won't want to do any of that stuff. It'll just lay on the stall floor. We would prescribe the horse a sling that attaches to the rafters of the barn. and that would just make sure that the horse is upright and standing so the blood flow and everything keeps working for the horse. And then if it's in extreme cases, that might have the food and water given intravenously, which that would be worst case scenario. All right, the next disease is colic. So colic is the deadliest disease among domesticated horses. Colic is when the horse has an intestinal impaction or the horse has a little bit of gas that they can't release. So this is a disease that we see a lot in show horses, horses that you have as pets. This doesn't happen as much in wild horses, but for sure in domesticated horses. So a couple of symptoms that you should be watching your horse for. So loss of appetite. The horse will be laying down a lot. It'll be rolling, just overall be really uncomfortable and not really able to just relax and stand in its stall. So they'll be kicking at their stomach. Some horses even look back and bite at their stomach when they're kicking at their stomach. They'll be profusely sweating. You might see a little bit of bloated in their belly. They may be hard when you poke their belly. And then another one is a little bit of diarrhea. So what are some preventions for colic? Colic happens if you don't have a lot of water on hand for them. So make sure that your horse always has as much water as they want available to them. Grain can calcify and impact in their intestines and stuff. So the less grain you can feed them, the better. But that's a whole nother lesson that you can get into with what feeds you want to feed them. But grain can be affecting of colic. You always want to get your horse's teeth floated, so that just means get them filed down, make sure they're not sharp, make sure that they are able to continually chew up their food and they're not just taking in big clumps of food that easily could get trapped in there. And then have a good worming prevention plan. Worms can cause your horses to kind of have like an upset belly, and colic is an upset stomach. So, what we do for treatment, for not severe cases, if they look uncomfortable, you can tell that they have a little bit of gas. You just give them some medication called Banamine. You give that in the vein, and that's just an anti-inflammatory medication that you can give to help them with that. If they're more severe cases and you've given the Banamine and you cannot get your horse to stop rolling, kicking, sweating, bloated belly, diarrhea, all of those things, then you will have to take your horse to the vet and they will perform colic surgery. So the next one is heaves. So heaves is a less common thing, but it is still a disease in the equine world nonetheless. So heaves is a chronic pulmonary disease, much like asthma in people. So you'll see it a lot of times when your horse is running in the field. If you're riding your horse, you'll be like, oh my goodness, my horse is having a hard time breathing. They most likely have heaves. So some symptoms, your horse will get winded really quick. Like if you're trotting around the arena and you go one lap and your horse is already puffing really, really hard, you might want to get that looked at. Your horse will be wheezy, and then they'll have an increased respiratory rate just at rest level. So what are some preventions? Preventions for heaves would be the horse should avoid being in the dusty areas. So if you use um, shavings in their stalls that are super dusty, change your shavings. Try to cut down on any dust that they constantly live in. Another thing that you could do to prevent it from getting worse or having it would be to have your hay soaked in water. If you soak your hay overnight and then drain it out and give the horse the hay, there's no dust particles from anything on that. Treatments for heaves would be vets would prescribe an anti-inflammatory medication, or they will have an aerosol option, much like an inhaler for horses. Albuterol we give to horses as well. So those are some medications that we can give our horse. So laminitis is our next disease that we're going to talk about, and this is a condition affected by the tissue bonding to the hoof wall to the coffin bone. So it's caused by a disruption of blood flow to the laminae. When the bond is lost, the coffin bone may rotate within the horse's hoof and exit out of the bottom of the sole of the horse. So what that's saying is you can see in the top picture how there is a bone that's kind of pointy. So that pointy bone will rotate down and grow to where it comes out the bottom of the foot. So very, very painful for any horse that is affected by laminitis. So what are the symptoms? Increased digital pulse in the feet, unusual rings in the hoof wall. So you can see on that second picture how there's like his foot almost looks lumpy. And then frequent weight shifting. So your horse will never put its weight on a foot for too long. They'll constantly try to take the pressure off each foot. And then it severely changes the way the horses move. Most of the time, horses with laminitis will have a limp unless treated. So what are some treatments? So prevention with change of diets and exercise. So we can prevent this by not giving, most of the time it's ponies. Very rarely you'll see horses have them, but ponies have it a lot because of the sugars in the grass. So you can change their diets by maybe putting them in a dry lot, maybe only letting them have grass for so long, having their grain not be super sugary, just really managing their diets. Some treatments that we can do for our horses is medication. Any anti-inflammatory medication you can give them. Icing their feet, you can stand them in buckets of ice for a couple of hours a day. You could put mineral oil in their feed. Dietary restrictions like we talked about earlier, and then corrective shoeing. So once you've gotten kind of the pain down a little bit, you can put you can see in this picture there are full bar shoes. You can put pads on their shoes. You can do a bunch of things to make the horses comfortable and able to be ridden. All right, so another one is equine influenza. So equine influenza affects the horse's respiratory tract, and this is easily said the equine flu. So this is just like flu in people, it's the flu in horses. So symptoms are the horse is going to be lethargic, they're going to have a fever, and their lymph nodes are going to be a little bit swollen. So we prevent this by practicing good hygiene, by keeping things that horses use around them often clean. So this is just day to day. This is not even this is before the horse has the flu. Make sure you're cleaning your grooming supplies, cleaning their water troughs, their water buckets in their stalls, their feed pans, everything, just keeping it a little bit more clean around them, that no bacteria are growing to make them have the flu. Most vets will tell you just to allow the flu to run its course. There isn't much you can do for this disease. You can give them, if they have a really high fever, you can give them some medication for that. But other than that, you just want to let this disease run its course and keep your horse as comfortable as possible. All right, the next disease is equine infectious anemia. Equine infectious anemia is a disease spread easily and very, very, very quickly. It is a virus carried in the blood and transmitted primarily by horse and deer flies. So if your horse has this, um, some symptoms are extremely high fevers. A lot of the time, the horse's lower legs will be quite swollen. They'll have um, chronic weight loss, and they'll have some yellowing in their eyes. Some prevention is have your horse tested yearly and quarantine the horse that's infected. Keep it away from other horses. Like I said, it spreads very, very quickly, so having your horse not by others is imperative. And then for treatment, there isn't anything that you can do for the disease other than let it run its course, or this disease gets pretty hard for your horse. So sometimes euthanasia for the horse is the best route. You just kind of have to play this one by ear and see how your horse is dealing with it. If they have chronic weight loss and their quality of life is not good. There's no medication that we can give for the equine infectious anemia. So just keeping your horses quarantined away from others so you don't spread it, and testing your horse yearly is the best thing you can do for this disease. All right, so I know that was a ton of information. So if you guys have any questions, this would be the time to ask, and we can go back and we can look at some slides again, or whatever we need to do. I know it was a lot of information, so if you have any questions, this is your chance to answer them. Okay, if not, I'm going to go ahead and end my presentation there. Thank you guys so much for listening.